brain surgery, travel, and corporate-wide speaking events. This sounds like the life of a world-renowned brain surgeon, but if I told you these things can actually be a normal part of a speech-language pathologist's life? Yes, believe it or not, SLPs can explore way more work environments outside of a small clinic office for the rest of their lives. Today, I'm going to discuss 3 of the coolest opportunities the medical SLPs can take that aren't commonly talked about. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Number 1. SLPs can assist with brain surgery. More specifically, SLPs can assist neurosurgeons during awake craniotomies and brain mapping procedures. An awake craniotomy is a procedure that involves surgical removal of a portion of the skull while the patient is awake. Brain mapping, also known as cortical mapping or cortical stimulation mapping, is when the neurosurgeon provides electrical stimulations to different parts of the brain to identify areas that are critical for sensory, motor, or language function. Let's say a patient has a brain tumor that can be surgically removed. Before surgeons can go in and remove the tumor, they need to see whether or not removing the tumor would also impair the patient's ability to speak or move parts of their body. This is when cortical mapping comes into the picture. While the patient remains awake, the neurosurgeon will carefully apply electrical stimulation using a metal probe to specific parts of the brain to disrupt electrical activity in that part of the brain and see what the response is. So what would an SLP do? Well, the SLP will be consistently testing the patient's language and cognitive skills by showing pictures for the patient to name, asking the patient questions, having a conversation with the patient, and assessing whether or not there are any disturbances in speech, language, memory, or other cognitive communication functions, when the neurosurgeon halts electrical activity with each probe. If the SLP observes a change in function, then the observation is immediately communicated to the neurosurgeon. If language centers of the brain are too close to the tumor, then surgery may not be the best option for the patient. Ultimately, the medical team wants to make sure that they can successfully perform surgery on the brain without creating new impairments. Cortical stimulation mapping is also a common procedure for patients who want to undergo surgical treatment of epilepsy. This is the process where the brain tissue that houses seizure activity is completely surgically removed without resecting normal tissue or tissue essential for speech, language, and memory. But wait a minute, we learned in grad school that there are anatomical landmarks for language, like the superior temporal gyrus in the left hemisphere. Can't surgeons just avoid that part of the brain? Well, it turns out there's a lot of variability in how the brain is organized, which also changes with handedness. While approximately 90% of people who are right-handed are language dominant in the left hemisphere of their brain, only 73% of left-handed individuals house their language center in the left hemisphere. This is not a common job opportunity SLPs can come by, and it takes time, training, funding, and trust building for this partnership to develop in hospitals. According to one paper published in 2019 titled "The Emerging Contribution of Speech and Language Therapists in Awake Craniotomy, a national survey of their roles, practices, and perceptions," that was based out of the UK. Common barriers to participation in awake craniotomy include lack of standardized, validated language mapping methods, funding, standardized training methods, and guidance to direct practice. If you find yourself in a facility that does awake craniotomies with cortical mapping, it's worth the effort to build this partnership in the OR. If you follow the MedSLP Collective on Instagram, you may have seen our very popular post featuring an SLP who found a pretty unique job where all he does is work in the OR with EEG, nerve conduction studies, and intraoperative neuromonitoring. He told us that given his degree in speech-language pathology, he was offered an opportunity to revamp the company's language mapping procedures both in the OR and the bedside. When we asked him to share what a day in his life as an SLP assisting with awake craniotomies looked like, here was his hour-by-hour response. He wakes up at 5 a.m., arrives at the hospital at 6:30. His company policy is to get to the hospital at least an hour before the operation is scheduled to start to allow for setup and other OR-related tasks. By 7 a.m., he is changed into sterilized surgical scrubs. He and the team go to meet the patient in the pre-op rooms to make sure proper paperwork is signed and to get a rough idea of a current speech and language baseline. Gave us an example of a 25-year-old male patient with a frontotemporal brain tumor that was causing recurrent seizures. At the time of the operation, nobody was sure if the tumor was benign or cancerous and would be sent to biopsy post-op. By 7:30, the patient is wheeled into the OR. The neuromonitoring team that he is a part of begins their documentation. Hookups for this patient include a scalp EEG and leads to measure evoked potentials in his right extremities. Remember, he's been specifically trained in EEG and evoked potentials with this company. The EEG for this patient is to keep an eye on approximate levels of sedation, as well as to keep an eye out for any seizure-like discharges. The EP team leads him and the team periodically to test nerve integrity, ensuring that no sensory projection fibers are damaged during the operation. By 8:20, there's a timeout, where the team intentionally pauses to double-check everything important before the operation starts to reduce medical errors and improve patient outcomes. Then the first incision is made and the operation begins. Within 20 minutes, they've begun the process of removing the patient's skull flap. By 9 a.m., the surgeon begins opening the dura mater. Opening this covering gives the brain space to relieve pressure caused by the patient's tumor, and it begins to herniate through the hole in the skull. The surgeon had a nurse come into the room to run to the pharmacy to get some mannitol so that he can get water out of the brain and reduce swelling. At one point, the surgeon casually remarked, "So I'm just holding his brain in right now." The herniation is finally under control and the surgeon continues cutting open the dura. Around 9:45, the CRNA begins waking the patient up, thus beginning the awake portion of the awake craniotomy. The patient begins to respond to verbal stimuli. By 10:15, language mapping begins. The surgeon is delivering small electrical currents to very small parts of the brain while having the patient complete certain language tasks. He told us that it most often includes keeping the patient talking, but they also have patients count, identify pictures, and if they're working near the arcuate fasciculus, repeating phrases. Whenever a speech delay was noted, the surgeon was notified and he knew not to resect the tissue that was just stimulated. During this case, he and the team noticed that while the patient's speech was intact, there was some confusion. The surgeon refers to this as mass effect, which is the combined effect of all of the removed tissue impairing cognitive function in ways that no individual piece of tissue would. This entire brain mapping process takes about 90 minutes, and the surgeon begins to close the dura. By 12:45, the patient is put back to sleep so the scalp can be closed. By 2:30 p.m., the surgery is complete and they leave the hospital. If you want to read the full post on Instagram where we share his story and comment to ask questions, make sure to follow MedSLP_collective on Instagram. Number 2, SLPs can travel all over the country and likely get paid more for it. You've probably heard of travel nurses, but did you know you can be a traveling SLP? This means you can take on short-term or long-term contracts at facilities across the country. There are several reasons that this is such a cool opportunity. This allows you to see the country. Have you ever wondered what it was like to live in Southern California, Alaska, or Hawaii? Check out travel therapy. Spend your days off exploring nature, exploring the city life, meeting people from different walks of life. If the job winds up being pretty terrible, the good news is that it's only short-term. Most travel contracts might be around 12 to 13 weeks long. But sometimes you might even find a 6-week travel contract, and other times you might find a year-long contract. It's so much easier to show up to a job that isn't a good fit when you know there's an end date that's not too far off in the future. And the pay can be pretty good. Travel contracts can come with tax-free government stipends. I've had colleagues who are getting paid anywhere between $1,500 and $2,000 a week back in 2014, whereas before they were getting paid anywhere between $28 to $34 an hour at their full-time jobs pre-tax. Their travel pay allowed them to save up a lot more money in a shorter amount of time. You can take longer breaks in between contracts. Want to visit family after working a 13-week contract? Then make sure to find a contract that will let you start a week or two after your current contract ends. Heck, maybe you want to take a month off to explore Europe. Then enjoy that time off once you finish one contract with plans to start back up after your Euro trip. The connections you'll make can't be beat. As you get to know SLPs and other medical professionals across different facilities, you'll be sure to build lifelong connections and possibly even full-time job opportunities in the future if and when you decide to settle down somewhere. Building a network with other traveling therapists can also be incredibly rewarding. As with everything, there are a few potential cons or realities to consider when it comes to travel therapy. First of all, your contract can be canceled at any time. There isn't always work to be found, especially if you're looking at specific locations or for specific settings. You might encounter practice patterns that are very different from your own, and as a contracted employee who will only be there for a short amount of time, you might be up against some frustrating work cultures that you won't have much of a say in or an opportunity to change. Sometimes short-term housing can be hard to find as well, which can be easier to mitigate if you're open to renting out a room in an apartment or home instead of having the entire place by yourself. One of my very close SLP friends and colleagues once found herself without a job in Michigan for several months and debated travel therapy. One full-time position finally opened up at a hospital near where she lived, so she applied and got an interview. She wound up not getting the job and she felt pretty stuck. This was when she decided to take the plunge and see what the travel life was all about. She connected with a recruiter, told the recruiter she wanted to go to sunny California, and wound up getting an even better opportunity in Honolulu, Hawaii. She submitted her application, completed a phone interview, and got the job. This kicked off her year-long adventure as a travel therapist and made her pretty stinking grateful that she didn't get the full-time job she applied for in frozen Michigan. That year, she spent 13 weeks in Honolulu, 13 weeks near San Francisco, 6 weeks in Portland, Oregon, and another 13 weeks back at the first hospital she ever worked at in Virginia, reuniting with her friends. She will quickly tell you this was the best year of her SLP life and encourages anyone and everyone who has the freedom to travel to do so. Throughout that year, she explored national parks, hiked to mountain peaks, snorkeled with turtles, enjoyed dozens of food tours, volunteered with a surfing organization that made surfing and swimming accessible for people with physical and cognitive disabilities, made dozens of new friends and colleagues, and put a serious dent in her student debt with the increased pay she was getting. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about unique MedSLP job opportunities? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Make sure to stick around to the end to claim a freebie or two. Ditch the clinical and go corporate. Not all SLPs dive into diagnoses and disorders, and clinical assessments and treatment plans aren't always necessary. This is true for corporate SLPs. As a corporate SLP, you will be helping business professionals improve their public speaking skills, voice preservation, or accent training. Oftentimes, you'll hear corporate SLPs refer to themselves as a speech coach instead of a therapist because the goal isn't to diagnose and treat disorders as a therapist would. What's really neat about corporate speech-language pathology is that you might find yourself in a work environment that you would otherwise never expect to see as an SLP, like on construction sites, gyms, factories, banks, or other corporate offices. Corporate SLPs might get called in because there's a communication breakdown in a work environment and an employer wants to hire a professional to help, whether this is for public speaking, presentation skills, telephone skills, accent training, or voice preservation. There's a variety of needs that we can support across all work environments. Before you dive into the world of corporate therapy, it's important to decide a particular area of interest and develop an expertise that's needed in your area. It's also important to understand business, marketing, and public relations. Unless you find a practice that's willing to train you in corporate speech therapy, this requires a lot of independent research, studying, and networking. If you're interested in becoming a corporate SLP, one supportive network that I suggest checking out is CourseBand, the Corporate Speech Pathology Network. This membership network will connect you with other corporate SLPs and offer educational and networking opportunities to grow your practice. The same SLP friend and colleague of mine who did a year of travel therapy also did 1 year of corporate speech therapy through her private practice. The first case she had was a woman who is a lead employment specialist and certified special events professional. So she spent most of her time talking to large groups of people. She had seen an ENT before for her voice because she felt like she would lose her voice after a busy day of events. Luckily, no vocal pathology was identified, but it left her with no referrals to an SLP or anywhere else to find help. With prior assessments and a clean bill of health known, my friend was able to set up a session with this client in her work environment. She spent the first part of her day sitting in on this woman's morning lecture to a new group of employees and took notes of her voice and breath habits. She also got permission to take several recordings of her client speaking during the lecture. Using this information, she was able to point out any negative habits that led to poor vocal hygiene and reduced breath support, and set up a coaching plan to help her client practice voice preservation. This helped her client eventually eliminate vocal fatigue, which made her feel surprisingly more energized by the end of the day. She was so impressed with the results that she invited my SLP friend to a local networking event to help her business grow. Want to see what it's like to work in a variety of settings as an SLP? Make sure to follow us on Instagram and check out the Day in the Life series we've posted. From NICU to brain surgery, we share a lot. Head on over to Instagram now and follow MedSLP_Collective or click the link in the description below.